Jessica Armstrong. May Green. Anna K. Brown. Jamie Calderon Torres. Kristen Carl. Chastity Carminar. Hannah Cassar. Tatiana Chara. Dana Churchka. Celica Del Rosa. Sean Dennis. Molly Doherty. Cassie L. Olivine Ornelas. Joey Baptist. Tatiana Franco. Lester Gilman. Gloria Gutierrez Bueno. Kristen Hayes. Estella Pisoli. Julissa Infante. Nadine Jean Baptiste. Emily Kempa. Daphne Lafortin. Julika Levy. Ashley Lewandowski. Cindy Lopez. Laura Lopez.
What if you right click on that?
Marilyn Lucas. Kelly Madden. Jennifer Major. Ebony Mahon. Christina Mayorga St. Amand. Aaron McCormick, Louise Mendez, Crystal Maurice, Adina Metellus, Diane Morales, Laura Nowosky, Adriana Carranza Payne, Stephanie Petropoulos, Jane Riley Anderson, Keanu Rodriguez, Tatiana Rosa, Cassia Silva, Cornelia Strachan Burrell. Daniela Swain Biofrio. Megan Talmadge. Laura Tarzia. Jen Terebka. Elizabeth Townsend. Desiree Velasquez. Catherine Villanueva. Brittany Wills. Denise Wilson. Congratulations, class of 2023.
Now they have to shoot at your program. Take a pledge.
Give it up for class of 2023. Try not to cry. I'm so grateful to have a career that gives students the opportunity to make a difference. People I'm appreciated for all that I have and I've learned over the past 2 years. I would like to thank you all. I would like to thank all of the nursing professors and clinical staff at NCC for all their dedication and time and leadership. All of you have been truly amazing and never gave up on us. Mrs. Tanisha Tyson is our nursing director and second year faculty. Her encouragement, passion, and push were a constant reminder of my goal to become a registered nurse.
Our next faculty member. She's the definition of nurse excellence and gave the nurses like us in our class faith and hope that we can be as such. Strong, smart, and caring, with grace and intelligence exuding from her name. I am blessed and grateful to have been taught by her. Please welcome our nursing department chair, Mrs. Tanisha Tyson.
Y'all look great. And you're doing great. That's all I was trying to say when I come in class. You're doing great, you're looking great. And that's why I'm saying that clinical as well, to give them positive encouragement. Because sometimes you don't need to be hard, but you need to give them positive encouragement and they're still on point. And you look all amazing today. Good evening. As I said, my name is Tanisha Tyson. I am the chair of the nursing department. I also teach second year nursing faculty. Nursing is my passion. I have never wanted to do anything else but teach nursing. And I knew that from a young age when my 35-year-old aunt had a heart attack in front of me and passed away. I knew this is what I was supposed to be doing. So I left bedside nursing 7 years ago to come teach. And it has been the most rewarding. And this is what I'm supposed to be doing. I'm supposed to be here feeding it to you guys. And I'm so proud of everybody here. And I just can't say enough about this class. This class is a different class. They're ranking. No, I'm not saying different. They're ranking different in a good way. You guys are going to say lies out here. But this class is also a class, it's a caring class. It's a class where they're concerned about the community. This class went out, they packed Thanksgiving baskets to make sure our community ate. They actually helped with Easter baskets to make sure that people had food for Easter. This class is a different class. They have heart and passion, and I love that. Congratulations. Dr. Brown, we did thank the foundation, thank the CEO, thank our dean, Tony Leifer. We have a wonderful team at NCC. I just want to thank a couple of other people. I'd like to thank our nursing advisor, Susan George, our nursing simulation coordinator, Shakima Burke.
No,
I'd like to thank our program assistant, Catherine Hera, our nursing administrations director, Robin Morris. I am the liaison between the hospitals and NCC, and we would not be able to graduate and train these nurses without the hospital support. So I would like to thank Norwalk Hospital leadership team, Leslie Lincoln, Allison Barco. I would like to thank Greenwich Hospital, Anna Sarah, and Loretta Jacobs. I would like to thank Silver Hill leadership team, and Matthew Khan, and Deborah Ostrich. I would like to thank Stanford Hospital, Mary Curran. These are the people I speak to daily to make sure that our nurses are trained, and all of our second year students go to hospitals to make sure they're trained in a very special way and to make sure they're trained properly so that when they go out to the units, we're hearing wonderful things about our NCC graduates. I would also like to thank our faculty. We have a dynamic faculty. Thank you, thank you, thank you. We have wonderful clinical adjuncts that come and support our students and they pour into our students. Without the dynamic team of the hospitals, our nursing director, Dr. Dominique, our faculty, we would not be able to produce this village and this nice graduate class. Thank you so much. To the graduates, remember when you leave today, nursing profession is an art. Each day you will learn something new. Every day you go into work, you should say to yourself, what did I learn today? Maybe you put a smile on a patient's face. Maybe you put a smile on a family member's face. Maybe you helped a coworker learn something new. Remember, it's an art. It is not routine-based. Do not become check mark nurses and check box nurses. Because once you get into routine, you lose your passion for nursing. Every time I get in front of you, I have passion, and that's because I understand the art of nursing. I want you to, I'm pouring that into you because I'm serving you with that task to remember this is the art of nursing. It is just not a job, it is a profession, and we need to remember that, okay? Each year I'm pinning in graduation, I think to myself, what has this class taught me? What has this brand new 2023 class taught me? I go back through the lectures, I go back through some of the academic things and find out exactly what this class has taught me. Because each year I learn something different because this is a learning profession, remember? As I review this academic year, I remember that your class taught me that this nursing profession is still full of heart and passion. It is okay to share your experiences. It is okay to wear your heart on your sleeve. And finally, breathe and unmask, because we just unmasked the hospitals. We thank you for all your hard work, your passion, dedication. Remember the words of the great Michelle Obama. Success isn't about how much money you're going to make. It's about the difference you make in people's lives. Go to work each day to brighten or change a patient or community member's life. Ask clarifying questions. Remember to smile, your mask is off. And remember to protect your blue card. Somebody out here is going to ask you to do something foolish, and you need to ask a clarifying question. It will cost you big time. It will cost life. It will cost you your license. And you will never be able to shake what you did to that person if you don't ask a question. One question to save a life. Congratulations, class to our class of 2023. I'm beyond proud of you. I have the pleasure of being able to introduce the nursing awards that's given by our nursing faculty and director. This award is for a student of promise and distinction. It's given to a student who's gone above and beyond in one or more leadership roles, demonstrated tremendous leadership ability in volunteer roles, possessions of leadership qualities, and distinguished them from other students. This award goes to Jessica Archibald. Jessica was our tutor for our nursing 125 students, and she stepped up to the plate and helped some of our students be successful. The next award goes for Outstanding Leadership Award. This is a student who has demonstrated leadership among his peers in service, community, profession, and maintained professionalism while maintaining high academic standards and clinical performance. This award goes to 2 students, Kelly Maiden, and Aaron McCormick. We have some students who are going to receive academic excellence awards. This is the student who exemplifies the qualities of professional nursing while consistently maintaining high academic achievement. We have 3 students who are going to get this award. Kristen Carley, Cornelia Strapian Burrell, and Kiana Rodriguez. The next award is the Spirit of Nursing Award. It goes to a student that demonstrates hard work, dedication, compassion, and exemplifies what nurses do each day. We have 3 students receiving this award: Lisa Stevens, Jane Riley Anderson, and Jesse Caranello. The next award is the Advocacy Award. It's a nursing student who has met the challenges of balancing the nursing program without losing light of family and work commitments, a demonstration of passion and excitement for the nursing profession. We have a few students receiving this award. Cassandra Ellis, Tatiana Charles, and Brittany Wills. We have a few students that are receiving Clinical Excellence Awards. This is an award for a student who demonstrated outstanding academic and clinical performance in a clinical setting. This award goes to Celica Della Rosa. Nadij Jean Baptiste. And Tatiana Rosa. The next award is Professional Development Award. This is a nursing student who exemplifies growth and development during their time at Dog Community College. This award goes to 4 students: Haley Cruz, Hannah Casera, metropolis. And Anna K. Brown. The next award is the Resilience Award. This award goes to a nursing student that has overcome obstacles and was able to succeed. We have 3 students. Megan Talmadge, Jaleesa Infante, Laura Novorosky. Our last award is for Warrior Nurse. This is a student that exemplifies selflessness. This award goes to Ebony Speaker. That ends our awards. Thank you.
I'm one of the oldest students, so I need glasses. Sorry. First, I want to thank all of you for being in the audience tonight and supporting us through our journey to be where we are. Couldn't do it without you. Thank you for everybody that has come tonight. It was August 2021 when we gathered for the first time in the forum to listen to our first nursing school lecture. Each one of us energized, rested, excited, and a little nervous, wearing our fresh, clean uniforms, ready to take on the program. Little did we know just how much our lives were about to change. And I'd like to start by giving us a case study, because this is what we do now. Patient presents with tachycardia, shortness of breath, and stated they were experiencing palpitations and what felt like a never-ending panic attack. Patient is diaphoretic, tearful, and experiencing minor tremors, and is pacing back and forth. Patient also states a progressive onset of anxiety and insomnia for the last 2 years. The patient continues to state their anxiety triggers are brought on by exams, clinicals, having to volunteer in sim lab, and waiting for grades to be posted on Blackboard while constantly refreshing a million times. I know you know this patient because it's us. So now let's do a few nursing diagnoses. Sleep deprivation related to late nights of studying, as evidenced by bags under the eyes. Impaired social interactions related to excess studying, as evidenced by patients stating, "I really miss my friends." So what do you think the provider will order for this patient? Today! Woo! And what patient education are we going to give? We're going to teach them about deep breathing techniques, guided imagery, and let's not forget yoga. The answer is always yoga. So this case study represents the roller coaster of emotions we were all feeling along But look at you now, all fancy in your white uniforms, looking so good. Yeah? So we survived the caffeine overdoses and significant loss of sleep. And even in those times we did sleep, I would not be surprised if you thought you heard, "Hey everyone, this is Nurse Sarah with RegisterNurse.com in your head." So some may ask, why did you put yourself through this stress? It's because there is something personal inside each one of you that has been called to this noble profession to help and care for others as we have experienced in clinicals. And speaking of clinicals, what did we personally experience? Starvation, dehydration, very few bathroom breaks, sore feet, dry, cracked hands, and at times tears when we lost confidence in ourselves and the doubts crept in strong that maybe we didn't belong here. But we also experienced the joy in the journey of helping a patient recover, helping them feel more comfortable when they were hurting, listening to them when they didn't have anyone else, and simply holding their hand in silence so they were not alone. And when a patient tells you that you are going to be a good nurse, that is when you know you are right where you should be. Maya Angelou said, "People will forget the things that you have said. They will forget the things you did, but they will never forget how you made them feel." And we have that opportunity to make those kinds of positive impacts every time we enter a patient's room. And I am confident in all of us, lost my line, all of us, that we are prepared to set sail into our careers with the abilities to be a great nurse. Because one of my clinical instructors said, "Don't settle to be just a good nurse, be a great one." And to be great, And to be great, we had to come from something great. So let's never forget our roots and those that raised us, encouraged us, picked us up when we were low, had belief in our abilities when we weren't so sure of ourselves, praised us for our achievements, tested us to think critically, and sometimes when necessary, gave us the tough love that we needed. Without our fearless leaders who built our strong foundation, we would not be sitting here today. We are all the products of your knowledge, wisdom, and expertise, along with the humor each one of them provided to either lighten the moment or hammer something home. You should know this. And it always came at a time we needed the laugh, and those are the teaching moments we won't forget. So as we say goodbye to the NCC Nursing Program, we take with us our memories, our friendships made, and the experience of a lifetime that not everyone gets the honor to have. We have discussed that the culture of nursing is not what it used to be, and it reminded me of a quote by Aristotle. "We cannot change the wind, but we can set the sails differently." So let's be a small part of that change in the culture. Be helpful when you can. Be encouraging to others that follow behind us. Be a mentor as we need them to. You never know how the smallest change can result in the biggest impact. So lastly, give yourself some applause. You deserve it. Give yourself some respect, because you earned it. And give yourself some love, because you're worth it. You worked so hard. Congratulations, 2023.
moment to recognize each of our faculty members. And Cassie. Our director, Dr. Dominique. Our nursing chair, Miss Tyson. Dr. Astor. Professor Brennan. Professor Hooper. Professor Corrali. Professor Leedis. Dr. McNeil. Dr. Nye. Dr. Vincent. Professor Edwards. Our simulation coordinator, Ms. Burke. And our clinical instructors, Ms. Chaco. Ms. Dancy. Ms. Devane. Dr. Diaz. Ms. Xantis. Ms. Gall. Ms. Gordon Cohen. Ms. Halachek. Ms. Maxwell. Ms. Pan. Ms. Pinto. Ms. Williams. Ms. Youngblood. Our advisor, Ms. Susan George. And our program assistant, Ms. Sarah. And again, thank you, Ms. Anna Sarah. Now I'd like to welcome to the stage Lisa Stevens. So I'm on the same boat as Laura. I need glasses. So I'd like to extend a thank you again to all of you for being here on this really special day that we've all worked really hard to get here. I'd like to extend a special thank you to our family and friends who have walked alongside each one of us as we pursued our degree in nursing. There have been many times each one of you have probably had to remind us to keep going when we were tired, doubtful, and stressed. So please know that without your support, we could not have come this far. This has been a short 2-year journey that at times seemed to be long and never ending. But this was in reality a short time, but with long-term benefits. It's hard to imagine that it wasn't that long ago we all entered the forum at Norwalk Community College, donning our blue and white uniforms, enthusiastic to start this journey, but nervous about what was ahead. From beginning with learning how to introduce ourselves to patients, proper hand hygiene, learning the nursing process, and how to take a manual blood pressure now seems second nature in comparison to a more complex progression of learning of cardiac conditions, EKG readings, and end-of-life care, and much, much more. And who would have imagined that raising the head of the bed would have resolved so many things? And it does, at least to start with. So I imagine many of us thought this day would never get here, right? And as a class, we have gone from being strangers on that very first day to developing lifelong friendships and memories within our class that will last a lifetime. We have seen one another at our worst and our best. We have laughed and shed tears, probably lots of tears, but remain determined and devoted to becoming nurses. What is the definition of a nurse? Well, Webster's dictionary defines a nurse as follows. Nurses are licensed healthcare professionals who practice independently or are supervised by a physician, surgeon, or dentist, and who is skilled in promoting and maintaining health. All of that is true, but being a nurse is much more. I believe that nursing is more than just a job. It's a calling. And the definition of a calling is that it is a strong urge toward a particular way of life or career. It's something inside each one of us that is accompanied by compassion and empathy, that of which is the initial foundation of being a nurse. Our skills and education are built on them. A nurse not only gives medications and morning care, to name a couple of things, but nurses are who patients lean on when they are scared, anxious, or perhaps angry at their situation. Nurses not only lead and care with what they've learned through training and education, but patient care is also centered around compassion, understanding, empathy, and advocating, which also aids in our patients' outcomes, along with, of course, the physiologic patient care. The nursing program at Norwalk Community College has equipped us with a strong foundational learning, has molded each one of us to be professional, confident nurses, and nurtured us along the way. So on behalf of our class of 2023, I would like to thank the nursing faculty and clinical instructors for your patience as we struggled at times when learning new things. You also got to witness when things started to click and celebrated our victories with us. Thank you for your compassion and empathy toward us. and for your unwavering motivation, encouragement, and correction when we needed it. I imagine this is somewhat like raising children. You guided us, you taught us, corrected us, nurtured us, and now it's time to let us go into the field of nursing. Well, I have to say from that perspective, you all have raised us right. Each one of you have made an impact on us that we will always remember. Each one of you are incredible role models and live out what you have shared along the way. So thanks to each one of you for being a prime example of what a nurse is and should be. And I am sure you have not seen or heard the last of us. I would also like to extend many thanks to the healthcare facilities that welcomed and embraced us students in the clinical setting. Probably the part we like the most, right? To Norwalk Hospital, Greenwich Hospital, Stanford Hospital, Danbury Hospital, and Milford Hospital, Silver Hill and the nursing home facilities, the Jewish Home for the Elderly, Fort Chamberlain, Waveney, and Nathaniel Witherall. It was a privilege to be able to learn from your nurses and especially care for your patients. The hands-on experience of which our nursing program continuously and tirelessly makes sure we have has benefited us greatly and has aided in molding us into the nurses we will be. So this pinning ceremony represents the bittersweet close of one journey and the beginning of another. To my fellow graduate nurses, this has been a hard journey. So I hope each one of us will not forget from where we came. My prayer for us is that we would not lose our zeal for becoming a nurse, that we would remember to find ways to take care of and nurture ourselves, because we can't take good care of others unless we take care of ourselves too. Soon enough, after we pass our NCLEX, right? First time, all of us. We will move on to our various nursing roles. Some of us, hopefully all of us, will experience victories when a patient overcomes an illness, or witness a new life being born, or we may just be that nurse that holds a patient's hand when they take their last breath. Perhaps some of us will move on to be leaders in healthcare and continue to make a difference in various ways. So wherever this journey leads, let's hold fast to our compassion and our empathy for others and not allow the stressors to cause that to waver. And so, and I know we couldn't hear it when we were coming in, but there's a lyric from the song that was being sung. We will change the world with the things we've learned. Congratulations, class.
Class of 2023. This is it. Thank you very much everyone for coming. So we're happy that you are here with us today. Thank you for helping them, and we wish to see you again next year. Thank you very much. Bye-bye.
Go with it.